Well, Integrity Hospice is something I'm proud to be a part of. It's a hospice by nature is to take care of the people who are in their dying years or dying months, days it could be. And you have to be a compassionate group when you're working with these people. A lot of times what happens is that I would see through the 20 years that I have in healthcare is that a lot of the other companies were putting business ahead of the patient. And the main thing that we wanted to be a part of was to make sure that Integrity Hospice, that we were constantly putting the patient first. That's been my desires with Geico Healthcare, and it's been successful through the years to make sure patient first, business second, and it works out. And that's what we have done with Integrity Hospice to make sure we're looking after the resident. Take care of the patient like you should, then everything else will take care of itself. One of the things that Robert has always wanted to do is have a very low nurse to ratio patient load, which is good, which means you can take care of less people and spend more time with them. So I've been proud to be a part of that, and we're here to serve our community to make sure that Integrity Hospice can do the best possible job for the people that are in a natural part of the life, and that's in the dying days, and to make sure that the whole family is able to understand what's happening and how they can help and what to expect.
Hello everyone, we'd like to welcome you to Real Talk. I'm your host Pat Theriault, and it is another day in the life of a nurse. We're featuring some amazing men and women here at the Fairview Park Hospital and the great things that they do for individuals here within our community. We've got this wonderful young lady with us here today. We've got Brandy Jones with us. How are you?
I am good. Thanks for having me.
Good to see you.
Thank you. You too.
Thank you. So listen, Brandy, we want to talk a little bit about you. But then we want to talk about all of this infection control stuff that you're in charge of, okay? All right, share with us a little bit about you.
I'm Brandy Jones, and I'm the Director of Infection Control at Fairview Park Hospital, and I've been here for about 4 years. I've been a nurse for about 16 years, originally from Hawkinsville and now live in Cochran, so I drive about 30 minutes here, but it's a great place to work.
Right, it is.
I am the mother of two beautiful little girls, Ainsley and Emily, and I've been married to my husband, Alan, for about 16 years, too.
That's wonderful. Now, how old are your girls?
Ainsley is 12 and Emily is 10.
You know it's summer now. Summer school is out.
Tomorrow is the last day. It'll be great.
What are you going to be doing with these girls?
They're going to have fun. Yeah. And I'm going to come to work, but that's okay. Somebody has to.
Somebody has to. Somebody has to. Now, how do you keep everything balanced? We always like to ask, about the balance of things because we are all very busy. We lead very busy lives, and to juggle being a wife, to be a mother, and working in this position, what do you do to keep balanced?
Well, it's a juggling act for sure. So I have a great support system at home, and my husband helps me. But, when we're at home, we're family time, and when we come to work, it's work time. And so we're just lucky that we have jobs that are flexible and let us be with our families when we need to be. And then we can devote all of our attention here when we need to be. So it's a give and take. And my kids are great, too, and they know that I come to work and that I'm the hand washer person at work is what they think I am.
You are more than the hand washer.
But that's what they think. Yes. So, right. And that's where it starts, so it's good.
Reading your sign up there, it says, wash your hands and say your prayers because Jesus and germs are everywhere.
And that is so true. And if people to remember that is the root of everything.
It is. My kids used to kind of have angst with me when I used to attach, hand sanitizer to their backpacks. And I'm like, you're going to thank me one day.
Yes, they will. They will. And that's great that you do that. And all school-age kids should have some hand sanitizer with them.
Exactly. So. And looking around your office now, you've got some cute little dolls in here that I'm quite sure those are not your daughters.
They are not. They've always wanted them when they were smaller, and I wouldn't let them have them. But those are my nurse. They're generic Barbies, but they're from Midline. And when I was new to infection control, the Medline rep at the hospital I was at was new too. So he brought me my first nurse Barbie. And then over the years at conferences, we have educational conferences, every year for infection control. And so Medline brings those dolls, and I've collected the whole set.
They're so
I
cute.
love them.
They're so cute. And your office looks so fun and so cheerful with the different paintings. You've got your daughter's paintings in here, it looks like.
Yes.
So you're definitely a mom in here. Definitely a mom. So let's talk about your position and what that entails, and who do you have working with you in infection control?
Well, I'm the director, and then Tamara Allen is our sepsis coordinator, and she works in this office with me. So sepsis coordinator, she's looking at infections and degrees of infection, because you can be a little bit sick or a lot sick, and we want to keep you from getting a lot sick, because then your body starts shutting down and you have things going on. So she looks at all the patients, and we see how sick they are, and we have all these practices in place to help you not get very sick.
And so let's see, in the scheme of things, let's do some type scenario here to understand where you all come in to patient care. Okay. So a patient comes in. Now this is a patient that's in-house, correct?
Right.
And let's say I'm here because I had to have surgery, knee surgery.
Okay.
Where do you fall into that?
Lots of different places. So for infection control, what we look at are guidelines. So everything is evolving. Healthcare is not the same today as it was a year ago, 10 years ago. It's certainly not 100 years ago. And it will not be the same next year or 10 years from now, because we have all these new technologies coming out. We have new antibiotics, new disinfectants, new everything. So it's up to me to keep up with the latest guidelines, the standards of care, to see what we should be doing to provide the best care. Some things are okay, they're fine, they're just not maybe the best today. So we keep up with that. So if you're having knee surgery, we do things before you have your surgery, during your surgery, and after your surgery that you wouldn't even know about.
Now, do you actually go into the patient's room to do these things, or these are type assessments you do from reading the charts?
These are things like, when you're going to have surgery and you come in for your pre-op, we do certain lab work on you to make sure you don't carry certain germs.
Wow.
We do. And when they tell you to take your bath the night before, the morning of surgery, and then maybe they want you to use a certain cleaner to bathe yourself with, that's because we've kept up with the latest guidance on what we need to do to keep you from getting an infection after your surgery.
So that's your doing when we have to wash in that stuff. And
that's infection control.
Okay.
And then when you're getting ready for surgery, they're going to give you certain antibiotics at certain precise times before your surgery, and it's all to keep you from getting infections afterwards. The dressings we use, the things we use to clean your skin before they cut for your surgery, all those things are looked at, and they're all best practices and standards of care, and they change. And so when you change something, it's not like you just come in one day and say, we're going to change this product and we're going to do this.
Right.
You have education for staff. You have education for the physicians, for everyone in the hospital, from the housekeepers up to the CEO.
That is so interesting. So let me make sure that we are understanding you. Is infection control is a course for the patients in-house, or patients that are seen here, but also for everybody that works here, like the things that they have to do to make sure that they are being safe.
Right. Everything we do in this hospital, every person that's in here, even the volunteers, we have certain things that we teach them, that we recommend to keep them safe and to keep our patients safe and to give them the best care. And
so what you talked about having to get, of course, continuous education about these conferences and things, how often do you have to go to find out the latest? Because you say things are changing all the time. We have educational conferences annually, and those are always wonderful. We have them at the state level and national level. But as new things come out, the CDC, they push things out to us through email, through regular mail, too, but email, of course, is the fastest. And we also work with our public health providers here. We have district public health, the state level, and we work very closely together. We call each other when things are emerging or coming out, and we keep up. And so do you provide, like, in services for employees? Like, do you do trainings? Like, okay, guys, like the big thing, like with the Ebola. Yes. I bet you were like... you know what I mean? Fun. Like, so, you were probably, having to be on your toes. Every T had to be crossed. Every I had to be dotted. What precautions did you all have to take as, a medical facility when that outbreak came?
It was major, and so during a normal work day, you're doing your normal workflow, and then you get these pushes out from CDC and Public Health that we have, Ebola, and that it could be coming into the United States because it really is a small world. So you pretty much at that point, it is. And especially, people don't realize it because you think that's never going to happen here, but the Air Force Base is just right up the road, and people now, we have so many government contract workers that go back and forth overseas, you just really don't know. So when something like that happens, when I get a phone call about that, you pretty much stop what you're doing that day and you turn all of your focus onto the emergency at hand.
And so what kind of precautions did you have to take and during that time?
We had to, well, first of all, you have to screen patients when they come in to see have they been overseas and have they been to these places. And with that, the infected places changed every couple of weeks. They would let somebody come off the list and they would add new places to the list. So you would have to continually update our screening process. So when you came to the hospital, there were signs posted first that said, if you have been, and it lists the places, let someone know immediately. Okay, and then the staff at the desk, they were trained to ask everyone that came in, have you been to these places? If they said yes, they were immediately whisked away.
Whisked away.
But it's for the good because you can't have them, in the waiting room.
So what did you have cases like that where you had to whisk them away?
We did, and when this first, came up and people were, more scared really of it, they would come in. We had some missionaries that had been overseas and they weren't sure about the time frame, and so to be precautionary, we immediately isolate those patients, and I believe we had one more, and it was one of those things where you weren't sure, they weren't sure, but still
just to be it's better safe than sorry, so to speak. Was there panic? Honestly, because even in your professions, you're still human. You're still a mom. Like you've got 2 kids and a husband, and you're like, okay, all of these things that were.
It's scary, and you do. I mean, because we are, we're nurses and physicians and lab personnel, but we also go home at the end of the day.
Absolutely.
And you don't want to take anything home to your family. So there is some concern, and you do get those concerns. And so what we do is we work and we keep up with the CDC guidelines, and we keep everybody safe.
And we're so glad that you're keeping up with everything. So let's talk about, so when you had to isolate someone, like what did you had to dress a certain way?
You had to be in a negative pressure room.
Negative pressure room.
A negative pressure room, that means that if this was a patient room, then the airflow in this room could not go out into the hallways, and it couldn't go into the ventilation. It's sucked in.
And you have that?
We have those in the hospital already.
Okay.
So the patient would go to a negative pressure room, and then the staff would have to dress out. And that was the key piece to all this, the Ebola emergency was the PPE, the personal protective equipment for staff, because Ebola, especially the blood, is very contagious in minute quantities. So just a little tiny bit is very contagious.
And so how could someone actually contract it?
It's through contact.
Just like touching?
Well, when it's on their body, blood, they also have vomit, diarrhea, any of those secretions, and so if
you see my eyes right now?
I know.
Oh my God. Wow.
And it's not hard to put on the personal protective equipment. It's hard to get it off without getting secretions on you. Because these patients are very sick, and when we say their blood and diarrhea, they have very upset stomachs. They have all these secretions that maybe they're not controlling well because they're so sick. So it's easy to get things on you and then touch your skin.
Okay, so let's go over this equipment. We want to go over the equipment that you all have to use to protect yourself. And you're actually going to put this on me.
Yeah.
Right?
It's going to be fun.
Yay. An activity.
You ready?
All right. So first, let's equipment that we're going to use, like the different things.
We are going to use boot covers for your feet, because remember, we're trying to completely cover your whole body. Okay, so instead of shoe covers, we're going to use boot covers because they come up to your knee. Okay, we're going to put on 2 pairs of gloves, 1 regular pair of gloves, and 1 pair of gloves that's longer. We're going to put on a cap over your head and then another hood over it to seal around your face. We're going to put on a full body gown that has long sleeves and tie it in the back. We're going to put on an N95 respirator mask.
Right.
And then we're going to put on a full face shield.
Wow. And so this is what you had to put on before
Yes.
you got into that room
With a buddy.
So you never were alone.
Never were alone, to make sure that you were sealed properly. So, and you have to remember too, it's hot after you put this stuff on. You
Yeah.
may be in this patient's room for a few hours.
Wow. We are definitely already, I don't know if you are out there, but we're definitely already getting a greater appreciation for what you do. Okay? All right. So in just a moment, we're going to start getting me prepared.
Okay, we'll get you suited up.
Okay. Very good. We'll be back. Okay, ladies and gentlemen, we are back. We've got Brandy Jones, of course, here, the Director of Infection Control. And we were talking about Ebola and the different precautionary measures that nurses and physicians and anyone working with a patient that's potentially contagious, the process that they had to go through. All right, and so are we ready to get started for you to...
We are ready. We're going to start with our boot covers.
And, you know, I said, you know, as a person who's not used to being in a hospital and not a nurse or anyone in the medical field, this makes me nervous.
I'm sure it does, and it made our staff nervous too. And we just have to reassure them that we're taking every precaution available to us to keep them safe, to keep their families safe at home too.
Yeah.
So.
You can tell I'm nervous when my eyes get real big. When my eyes get real big like that, Pat is really nervous. Okay. All right. So are we ready? I'm going to put this down and let's get started.
So the goal of this is to cover every inch of your skin and body. So that's what we're going to try to do. Okay? So we're going to start off with our boot covers. I'm going to let you put those on.
Okay. Very good. We're going to put this down.
So just slide this up over your foot. And then do it on the outside of your pants.
Wait, like that?
Like that.
Okay.
And then your next one.
Oh, is that right? Like
That is
That
right.
was the right way.
It's a little lumped up. Yeah.
Okay.
There you go.
And that is covering all of my foot. Okay.
Right, that's covering your foot. Okay. Now you can stand.
All right.
And we have this impervious gown. And so if we were doing this and you were going to go into a room, you would have a buddy. So I'm your buddy. So I'm making sure that you're covered and I'm tying all of your gown and we're getting you all good. So
Okay.
now if we were doing this for real, if this was a little big on you, we would take duct tape right here and seal it.
Wow. Okay. Okay. And you know, I was thinking too, you know, during this time, during this outbreak, there was a lot of like nervousness throughout the country, you know, from people. And so this is such a serious business that you were doing. And with this being the first time hearing about Ebola here, you know, this was new territory.
It was new territory, so we had to actually practice doing this with our staff. So we had teams that went out for day shift and night shift, and we did all the floors, including housekeeping, because the rooms still had to be cleaned. And we had to have them put on their PPE and take it off and certify that they could do that appropriately.
By themselves?
With their
With
buddy.
the buddy. Okay. Very good. Thank you, buddies. Okay.
Yes, thank you, buddies. Okay. Now we're going to cover your hair.
Is it going to fit, honey?
It will stretch.
Okay.
We're going to mess up your beautiful hairdo.
All right, let's go.
Now, if we were doing this, we're going to let you have a little bit of slack here. We would be pulling your hair back and all those things.
All that and get it all in there.
But we won't mess up your pretty hair for
okay.
today.
Get it, but this needs to go in.
That would go in.
Here, hold this.
Okay.
Do it, honey.
You
Wanna
do
get
it.
in there?
You are good.
Try to get it all in there. Give me a second.
And we're going to do another hair covering too. So.
You see, I'm having to look at myself in the mirror.
And you could not do this by yourself, you know.
I really
so.
could not. Honey, I got a lot right
You
there.
do.
Okay, let's just go from
Okay.
there. All right.
This goes like this.
Oh my God.
Now hold this in. I'm gonna tie you
Okay.
down.
And this is covering everything. And you would have to wear this for a couple of hours.
Yes.
Probably more than that,
Yes.
depending on the time with the patient.
And again, if this was loose, because we don't want your neck showing,
Nothing
we would
showing.
fix all of
With
this.
duct tape
Right.
to make sure it's all in. Okay. And you know, people have seen this like on national television where they've had to do
Yes,
all of this,
that's
and
exactly right.
and seeing when they're in the other countries and okay.
Okay, we're going to put on
Two-
two pairs of gloves.
2 pairs of gloves.
Because when you take all of this off, you don't want to contaminate. So you'll need the outer pair that's going to be dirty. You're going to have the inner pair that's not as dirty. Okay, so it's going to help
Okay.
when you take these things off.
Okay, very good.
Let's see. This is going to go like that.
Okay.
Oops. Okay, and that's a short pair, and these are going to be longer.
But are going to cover all of that.
Right. And these are going to be a little tighter too.
Okay.
Okay.
This doesn't work using a microphone. Okay, can you get it from up there?
Yeah. And it may-
And it is so understandable why you have to take these precautionary measures.
It is.
With the nurses and everybody receptive and
They were because they wanted to be safe.
Right.
So, I mean, yes, we did not have any pushback. I mean, they wanted to learn how to do it correctly.
honey,
So,
I would wear a whole bodysuit if I,
yes.
you know what I mean? Because these are, you know, when you are doing a service to save a life, you yourself have to protect your own.
Exactly. And we appreciate our staff that do take care of these patients every day.
That's a blessing.
Okay. Almost there.
Almost there.
Now, this is an N95 respirator.
Mm-hmm.
So, this is your mask. It's very stretchy. So,
Lord.
you may not be able to talk after you put
I
this
will
on.
not. Now, what is this thing right here?
That is just a comforting nose piece.
Well, it goes over my
It
head.
goes over your head. There you go. Right.
Like this?
Uh-huh. Let's see.
You're gonna have to do all the talking. Well, you can. I can.
We can. So you would put this on,
Yes.
and then there's a metal piece at your nose,
Uh-huh.
and you would bend it gently around your nose to seal it.
Oh, I feel it.
And this has
Oh my
a
God.
great filter in it, and only it filters out very small particles.
I feel it. Yeah.
Yeah, and that's probably what's going to make you hot is wearing the mask.
I'm hot already.
I
honey.
know. One more. And that is your face shield.
Yeah,
So
for
if
anything
there
that would
any
spew-
secretions,
Oh my Lord.
so now if I was your buddy and I was looking at you, I would say, is there any skin showing? And of course right now there's some at your neck that's showing, and we would fix that,
To
okay,
tighten it
before, right, and we would tie it up and fix it up in the back.
Okay.
So now you would be ready to go into the room to take care of the patient.
Wow.
Now the hard part is taking this off without contaminating yourself. So we're going to see if we can do it.
Wait a minute. I want the people to make sure they can see all of this. So this is all, is it all closed in the back?
You are all closed.
Okay.
And we would fix you up.
Now, question, how long did you all have to do all of these precautionary measures for this particular Ebola infection?
We are still under an Ebola watch. We still screen the patients on admission. We have not had any positive travel screens in several months. So it was January, February that it was a rough time.
All right, and so now I've taken care of the patient.
Yes. So now you're going to come out of the room and you're dirty.
I am dirty.
You're dirty. So your buddy is going to help you undress. Now, your buddy has to dress out too to help you undress so they don't get contaminated. Okay?
Oh, wow. So both of us would have this on.
So, Beth, but your buddy's clean and you're not. Okay? And it is such a hard process to get all of your PPE off that we have laminated sheets that are step by step to help the staff know what order to take everything off.
Wow. Let's see that.
And we have it, and we have carts that have our personal protective equipment, and we actually have these hanging on our carts.
That is
it's
so
there.
good. So everyone will know exactly what to do.
Because especially when you don't do it every day, and maybe it's a little while, you forget. So we have reminders. We don't want anybody second guessing themselves or not being sure and doing something wrong and getting sick. So.
Okay. Wow. Okay. So we're going to take this off in just a minute.
Okay.
Okay, Brandy. I'm ready to take it off.
Okay, we are going to take it off. I'm
Yes,
your buddy.
you're my buddy.
So we've got our handy guide.
Dandy guide.
Okay. Now, we would have some bleach wipes, and you would wipe your hands, and actually the bottom of your shoes first. We're just going to pretend like we did that.
Okay, so like this is when we're taking it off, we come out of the room.
Right.
I have to wipe the bottom of these things?
Yep. And we have all of these items, the wipes, on our carts.
Okay.
Where we would actually do this. Okay?
Very good.
So, you're going to take your outer gloves off first.
Keep in mind, people.
When you take your gloves off, you pull them like that, and they turn inside out.
Right here? Okay, hold on. Show me what.
Like this. And when you pull them down, then you have all the dirty.
Part that's hidden.
Right. And of course, it's hard because you have on two pair.
Okay, I got this pair.
That's why you have to have a helmet. There's one.
Okay. How many times have you had to practice this, Brandy?
Oh, many. 100.
My face right now, I'm fogging up.
You're fogging up. Okay, so now we've got, and we would have our big red waste container because
All this
red
stuff
means
goes-
biohazard, and we
Okay.
throw it in the trash.
Gotcha.
Okay. So now you have these gloves on, and they're kind of clean.
Right.
Okay. We're going to untie your gown,
Okay.
and I'm your buddy, so I'm going to untie it for you.
When do I take this mask off?
Not quite yet.
So there's a process for
There's
everything.
a process.
Okay.
Now, when we take your gown off, I'm going to help you because I'm your buddy. We want
Right.
to roll it.
You're rolling it. Like any
Yep.
kind of gook.
Exactly. We want to contain it.
Wow. Okay.
And same thing, it's going into our big red trash can.
Red trash can. Okay.
Okay.
Number
And you see
3.
we have it. Step 1, 2, 3.
This is so cool. If you can see that, she actually has.
And it has pictures too, so.
That's the for all the learners.
That's right. You never
Okay.
know. We're going to take your shoe covers off next, okay?
All right.
And same thing.
Same
we're
thing.
Roll them down.
And we've wiped them down with bleach.
Right. When you come out of the room, we wipe the bottom of your feet.
Is that the case in case something is spilled on the floor?
Yes, exactly.
Okay. All right.
When you come to a hospital, the whole room is considered dirty. You don't know what germs are where, so your whole hospital room, the floor, everything is dirty.
Okay.
Okay, so now we're going to take off your second pair of gloves,
All right. Rolling them down.
rolling them down. Doesn't that feel better?
It does. And the fact that you're fully dressed and you're having to
Right.
work with precision
Right.
under the most strenuous circumstances.
Okay, at this point, before you took off anything else, you would actually wash your hands. Okay, and at our places we have sinks there, so you would wash your hands.
Wash my hands.
Okay. And you would put on some fresh, clean gloves because now you're going to be touching your face. Okay, so.
So I would have to put on another pair of gloves.
Right.
We're
You
gonna-
would.
Okay.
Okay, now we can take this big face shield off,
Oh my God.
and it just slides right back. Ta-da!
I can see
that
clearly
feel
now the rain is gone.
Now, when you do that, though,
Yeah.
you had to be careful that you didn't touch
Anything.
You know, because if you just you can't stick your hand up under it and slide it off. You have to be careful because you don't want to touch your face.
Your face. Okay.
Okay, now we're going to take
Whew.
your mask off.
Oh my God.
Doesn't that feel good? And probably when you take it off, if it's caught, it's okay. You can let everything kind of come off together.
Okay. All right. How do I look right now? A
You
hot
look
mess.
beautiful. You have some lines on your face from your mask, but that's okay.
Figured as much. All right. So you take this off.
Take that off.
Let me look in the mirror.
And at this point,
Yes.
if you are really one of our staff taking care of
Right.
a patient, we would let you now go take a shower. And you would have some downtime, and somebody else would be taking care of your patient.
Really?
Yes.
All right, I'm going to go take a shower
Go
right
take a
now.
shower.
Right now. Okay, we are back. I am all showered up and you know,
Fresh as a daisy.
Fresh as a daisy. You know, Brandy, that was such an experience right there.
It was, and you know, that's the things that our staff do on a daily basis.
That's crazy, but it's so amazing because when I say it was an experience, that was just me putting on the outfit. That was not, you know, taking care of the patient. That was not making assessments, you know, that was not me servicing someone who was in dire needs right there.
Right.
And so when you add all of those dynamics,
Yes. It makes for a crazy day for the staff.
it
so-
does. But, you know, the good thing is we are so glad that you all are well trained and that you practice exactly what you preach. So it's not like, you know exactly what you're talking about. And if the people do, if the nurses, doctors, whatever practitioner has a difficult time with how to utilize the gear itself, you've got instructions for them.
Right. Instructions are always good.
Yes, very good. So this was a wonderful day. I mean, this has been wonderful. I hope that you all have learned something from what Miss Brandy has taught us today. Now, we want to give you the floor. If you have any last words or any comments or anything that we may have missed that you want to make sure the people out there understand and know about what you do.
You know, infection control is a broad topic, but really for people at home, you know, if you start with the basics of hygiene and keeping yourself healthy, hand washing, of course, kids, yourself, older people, everybody, if you would wash your hands, we would really prevent lots of infections.
Because so much is, you know, and I tell my kids that.
It's true.
Wash your hands. I washed them when I took a bath.
It's
My
the
kids would always
basics.
say that. I already washed them.
I know.
And so I'm going to wash them again.
That's right.
And so we thank you.
Thank you.
We thank you for the professionalism that you show. We thank you for the knowledge that you do have and what you deliver to the doctors, the nurses, the staff here, and then what you give to the patients here.
Thank you. We appreciate it.
We appreciate you very much. Ladies and gentlemen, this is Brandy Jones, who is the Director of Infection Control here at Fairview Park Hospital. We hope today's show was informative, that you did learn something. This girl here learned a whole lot.
Great.
You know, so we definitely appreciate you. We cannot say it enough. Thank you to you and to your staff. That's all the time we have today for Real Talk, a day in the life of the nurse. Brandy Jones, Infection Control Director. And you all, please, wash your hands and keep watching Real Talk.